Obsessive-Compulsive Disorder, OCD, is a mental disorder in which people have recurrent, intrusive thoughts, known as obsessions, and/or repetitive behaviors, known as compulsions, that are difficult to stop. The obsessions and compulsions can cause significant distress or impairment in daily life. There are 5 main symptoms of OCD: obsessions, compulsions, concerns, repetitive behaviors, and rituals. Obsessions are persistent thoughts or images that usually cannot be ignored. They can be anything from fears about dirtiness to worries about having infections. Compulsions are behaviors or routines that people with OCD often engage in an effort to reduce their anxiety or discomfort. These may include hand-washing, ordering certain items repeatedly, and counting words or numbers aloud. Concerns are the emotional components of OCD. They involve worries about things like contamination or bad luck. Repetitive behaviors are anything from checking locks constantly to making certain rituals such as praying or counting cards during poker games. What is the relation of obsessive-compulsive disorder and anxiety? Individuals with OCD may be constantly worried about contamination, missing details in a project, or having bad thoughts. In extreme cases, individuals with OCD may engage in repetitive rituals or behaviors to alleviate the anxiety caused by their obsessions. What is the effect of obsessive-compulsive disorder on relationships? It is estimated that around 1% of the population has OCD, which can be quite disruptive in relationships. In fact, OCD can significantly interfere with social and occupational functioning. To have a healthy relationship, both partners must be able to communicate effectively and openly about their concerns and needs. If one partner suffers from OCD, this can be extremely difficult because their thoughts are constantly racing, and they may become preoccupied with specific rituals or behaviors. This can make it difficult for them to trust or confide in their partner, which can ultimately lead to a withdrawal of emotional support. But what are the causes of obsessive-compulsive disorder? Scientists don't know exactly what causes OCD. There is no one cause of OCD, but it is believed to be caused by a combination of genetic and environmental factors. The exact genetics of OCD have not yet been fully understood, but it is thought that there may be a genetic component to the disorder. Studies have shown that people with OCD tend to have family members who also have the disorder, and that there appears to be a genetic link between OCD and Tourette syndrome. What are the different types of OCDs? While OCD can affect individuals of any age, it is most common in adults aged 18 to 44 years old. There are 3 main types of OCD: pure OCD, which is the most common type; OC spectrum disorder, which includes both pure and mixed cases of OCD; and obsessive-compulsive personality disorder, OCPD, which is a more severe form of OCD characterized by perfectionism and a high need for control. How is obsessive-compulsive disorder diagnosed? The diagnosis is based on the presence of 4 or more symptoms for at least 1 month, and a total of 6 or more symptoms in a 12-month period. To make the diagnosis, the clinician must rule out other possible causes of the symptoms, such as anxiety disorders and depression. OCD is most diagnosed in adults aged 18 to 44, but it can also be diagnosed in children and adolescents. The most common symptom is repetitive thoughts or behaviors that are difficult to stop and cause significant distress. Common examples include worries about contamination, symmetry, germs, and dirt, excessive washing, counting, checking, and ordering. How is OCD tested? There are many different tests used to diagnose OCD, but the most used test is the Yale-Brown Obsessive-Compulsive Scale, YBOCS. The YBOCS consists of 14 items, each rated on a scale from 0, none, to 3, severe, and is used to measure both the severity of obsessions and compulsions. How is OCD treated? Obsessive-compulsive disorder, OCD, is a mental illness that causes people to have recurrent thoughts or fears about specific, uncontrollable things. The most common symptoms of OCD are recurring thoughts or images that are harmful, uncomfortable, or intrusive. OCD can be treated with medication and therapy. Medications used to treat OCD include antidepressants, anticonvulsants, and mood stabilizers. Cognitive behavioral therapy, CBT, is the most effective type of therapy for treating OCD. CBT helps people learn how to control their thoughts and behaviors by changing their thinking patterns and behaviors. In conclusion, obsessive-compulsive disorder, OCD, is a mental disorder characterized by intrusive, repetitive thoughts and compulsions that interfere with daily life. Treatment typically involves medication and psychotherapy. OCD can be debilitating, but there are treatments available that can help manage the disorder. There are several types of OCD medications available, each with its own advantages and disadvantages. So, it's important to discuss the risks and benefits of treatment with your doctor before starting therapy. If you enjoyed the video, please like, subscribe, and share for more videos like this.